Hello, I'm Robert, fact checker and science blogger, and helping people scared of various things for Doomsday Debunked on Facebook. And do come and help if you also want to help scared people, or if you're scared yourself and need help. So this is a rather strange thing that's coming on to do with the UK with the COVID-19. It's said it's going to move to a delay phase. They're going to stop trying to contain it. But then it's not actually true. They're not actually going to stop containing it. They're going to continue the containment through the delay phase. But there's Dr. Whitty, there's Professor Whitty, and he says he doesn't think it can be contained. And it's all rather puzzling. So it is an answer to questions from MPs. He does agree that China have contained it. You can't hardly not agree. But he thinks that as soon as they stop containment, it's going to surge up again. He thinks there are many outbreaks around the world that are not yet detected, and there are many asymptomatic cases. But there's no evidence for this. And the Chinese study, this joint study with the WHO and China, and where the international experts, not actually doing anything, any agenda, but made up their own agenda, going around and looking wherever they want. And they were absolutely clear that it is happening, and there's very little evidence of any asymptomatic spreading. It's not just the fever clinics, there's also the big studies, 300,000 people in fever clinics, and there's the Singapore and there's Hong Kong, and there's various things suggesting there isn't. So in Singapore, I've already talked about that. I don't want to go in great detail, but they have, I think, 110 or something, maybe more now, cases. They're all in clusters, and they're not seeing anything else in the 5 million people in Singapore, and they're testing everyone with fever or pneumonia, and they're just not seeing it. And they're just not seeing the extra cases they should if this was going on. So this is very, very strange, because, and especially 2051 in, he says that Hubei province, that 20% of the people are reported as infected. It's actually 0.15%. It's all very puzzling. This is the Chief Medical Officer for England, and why can't he do his maths properly? Or am I missing something? Obviously he knows how to do maths. So it's very, very strange. How can 96,000 out of 11 million for Wuhan, 58.5 million for Hubei? It's not 20%, it's about 0.15%. And that's the number infected. And the seasonal flu tops out at around between 3 and 13% in the US. And this is less infectious than the flu, so you wouldn't expect it to go as high as 20%. So why does he think it would be 80%? He thinks it's going to reach 80%. I don't understand this. Why should he think this is going to be worse than flu, and even 20 times worse, or whatever? And then he in this questions, he then asks, why is it 20% instead of 80%? Actually, it's only 0.15%. He thinks it's a large iceberg not tested is one possibility. So it's actually many more infected than they realise. And the other is that the efforts of the Chinese push it down to 20%, actually 0.15%, and that if they take the foot off the brake, I've misspelled that, it'll surge. And he thinks as soon as they stop containing the infection, the rate will surge up. So this is a very distinguished person telling MPs just yesterday, or whenever it was, a few days ago. But this just doesn't match what's happening in China. This is not happening. He does not explain. So how does that explain how there's so few cases outside Hubei? Why isn't it surging outside Hubei? And what's more, those provinces have all contained themselves at much lower levels than Wuhan did. And 8 provinces haven't reported any cases in the last 14 days. 20 provinces have downgraded their public health risk from red to yellow, or from yellow to green. And 11 provinces moved to green today, which is their lowest level of risk. And in the last 24 hours, there have only been 4 cases outside Dubai, and that were from China. Most cases now in China come from other countries and are imported into China. So how can that possibly mean that it's about a surge in China due to them taking their foot off the brake, which they're already doing? People are going back to work, the factories are restarting, and I say all these, but many of the provinces have gone to green level, but they don't need to take any precautions. How can that be about to cause a surge? It doesn't make sense. It literally doesn't make sense. And he says that the UK, with 90 switches, 90 cases, it's now 100 and something I think, has switched to a delay. South Korea, to over 6,000 cases, continue with the contained phase. Now, if you're worried about all this, he's not actually going to do anything different in the decay phase, at least to start with. He thinks it's important to delay it for 6 weeks, and that this is worth putting quite a bit of effort into delaying it. And he also says that he doesn't want to kind of go a separate way from other countries. So we're not going to see the UK just sort of abandoning the containment that the WHO are calling for, and basically they're going to do the same thing as the WHO have asked of everyone, except that the UK are calling it a delay instead of containment, because he just doesn't believe that it can be contained, despite all the evidence. Now, you might wonder, how could someone not believe this when the evidence is so strong? Well, the thing is, he's coming to this with a whole lifetime of professional experience of dealing with the flu epidemics, which do not work like this. So all his instincts are against this. And we don't have that background. So that's why it's quite easy for someone who's not involved in that way to just come and look at this. You're not personally involved in anything. You haven't done any research before on the topic. You read the articles and the big report from China, and it's just very convincing. But Bruce Aylward, who wrote that report, he was the head of the report, and he said that when he started, and he's had decades of experience as well as a medical officer, medical researcher, and epidemiologist, and he says that he couldn't believe it, that he found it very difficult to credit because nobody has ever before contained a respiratory disease. That's what the Chinese have done. It's never happened before. And a lot of people are just sceptical, and even when the evidence seems very strong, they're coming up with what to us seem like transparent excuses. Oh, as soon as they take the brake off, it's going to surge up again. We can't see any evidence of that, but it's bound to happen, because that's what infectious diseases always have. All through my professional career, with numerous infectious disease outbreaks of respiratory diseases, they always surge. So this is going to surge, it's bound to surge. I just can't see it yet. But there has to be some hidden reason that is kind of hiding it. So I think that's how he's thinking. It's kind of understandable, but if you come and look at this new and you realise it's a completely new disease, and you come to it without these preconceptions from flu, then I don't see how there's any evidence for this at all. All the evidence is against it. He has not provided one shred of evidence for what he's saying. So, but anyway, he's doing the same thing as the WHO are asking, but he's doing it for different motivation. And his motivation is to move the peak of cases further away from the winter pressures. So the hospitals, they're full of large numbers of people with the seasonal flu. And that's why with so many people with seasonal flu, all the beds are filled. So he wants to move the peak of the cases further into the future, and it's worth putting quite a lot of effort into that, just in order to have the beds to treat everyone. Then he wants to buy time to improve our understanding of this disease. So targeted appropriately, develop countermeasures and drugs and diagnostics and new regimes for treating patients, and the antivirals and which ones work. Lots of clinical trials going on, and obviously if we can delay it until all those clinical trials are over, we'll have better tools for treating these people. And then another very strong reason is there may be a seasonal element. That is a reason to delay it through to spring, late spring, so March, April, maybe even later, because the later that we delay it, then it's the natural rate of transmission may go way down, so it may stop almost completely just by itself. So this will do, as long as we don't have a huge outbreak like Italy. I am so glad that the Italy outbreak didn't happen in the UK, because with this chap in charge, then I don't think they would have tried to contain it. They would have tried to start with, but by the time it reached 1,000 cases, they would just say, we just can't be tracing everyone for 1,000 cases, and they'd have given up. So I'm so glad that Italy is first off the mark here, although it's very sad for people in Italy. And so let's just have a little quick look. So here's South Korea, and this is the one that I want to start with. South Korea, they are close to containing. You see from this graph, it's steeper, then sort of leveling off again, right? It really looks as if they're containing it. And the WHO said today that it does seem that they're close to containing it in South Korea. So these are the total number of cases. It's just gone up 6%, just a tiny amount. And it should just level off, something like that. Maybe 6,000, 7,000 or something. Maybe a bit more. But just creeping up. Do you see these percentages? 40%, 32%, 35%, 34, 14, 11, 8, 6. Each time a smaller percentage of the amount you have before. So even if you have constant amounts, even if we say 100 extra every day, it'd be a smaller percentage. But this is actually less every day even. That is definitely on its way out. So I think he's obviously finding it very difficult to credit the Chinese. Look, here's the Chinese. If you look at that, that is Wuhan, and these are to the same scale vertically. This is Hubei outside Wuhan. This is the rest of China. That's very striking, because of course the rest of China is much higher population than Hubei. And look, it's gone up, and it's come down again. And it's just 3 weeks or so into the main part of the outbreak. It comes down again, way beyond. If it was just like the rest of this, it would go up to huge maximum. Here he is pointing it out, Bruce Hailwood. So when might they peak? Well, that's just an enlargement of that one. And so if the same, so there's I can't find anyone who's tried to model this. So this is just kind of guesswork, very broadest guesswork to give you an idea. So South Korea is already heading towards its peak number. It's already peaked. It had its peak number of cases. I think it's already had its maximum. So I'm a bit out of date there. It's already reached it. And Italy, you can expect on that same kind of time scale, maybe 2 or 3 weeks from now, it'll reach its maximum, just because we've got nothing else to go on. So why don't you just guess it's the same as the rest of mainland China, that's how long it takes to peak. So on that basis, Italy should peak maybe 2 to 3 weeks from now. And Iran again, same kind of time scale as Italy, but maybe Iran a little bit longer because it's much harder there. But on the other hand, they are very energetic about it. They've got a big Chinese team there. So Not big. They've got a Chinese advisor there. They've got the WHO there. They're being sent in lots of medical equipment. They've got excellent health service. They've got very high-tech equipment. So Iran is in a good position to contain it, even though it's obviously, from a large number of deaths, it's obviously they must have several thousand cases there. But Wuhan shows you can contain, 90,000, 60,000 cases. So for sure, Iran can contain it, and I think they are capable of doing it. I think they have the determination to do it. So now, if we suppose that all of them, so if we go, remember that the UK is delaying it, but using the same methods as as others are using to contain it, and they want to delay it for 6 weeks. So a very strong reason for containing all the cases coming to the UK, as long as it doesn't get too huge, as long as we don't have thousands. If we just have tens, dozens, maybe hundreds, then I can't see the UK falling back on these containment, because the UK would then be the one that spoils it. Italy is nearly containing it, and the Italians come to the UK and then it starts spreading off in the UK, and we couldn't be doing that. That'd be politically impossible for the UK. And the UK is so proud of its health service, the National Health Service, not being able to contain something when Italy is containing it. So we're going to be acting vigorously to delay the onset of the epidemic by 6 weeks. And I think we're lucky it's happening at this time of the year, because there are very strong reasons to delay it, because of the new season, that you're delaying it to the spring or summer. So it's not at all certain that it'll spread more slowly in the spring and summer, but it's certainly very useful as an incentive to delay it for 6 weeks, and it's certainly possible. The difference is not necessarily the temperature. After all, I'm in the UK and it's very cold here, and even in summer, then our summer is probably colder than the Italian winter. I wouldn't be surprised, or I don't know. I mean, we rarely get much above 20 in summer here in Scotland, and certainly the Singapore summer, winter, is spreading in Singapore. So it's not the temperature, it's that in the summer you start going out of doors a lot more, and you have your windows open. So here in Scotland, people have the windows open, up to 15 degrees or something, maybe less than that, 10 degrees. And people are out saying, "Oh, what a lovely sunny day," and and maybe 10 degrees or something. I don't know what the actual temperature is, so degrees centigrade. You say, "Oh, how nice and warm and how sunny," and go and sit in the sun and enjoy the sunshine. And so that it's more that if for your part of the world it's sunny, so you go out of doors, you're enjoying the sun, and you have your windows open, and there's much less sort of in a confined place with lots of the droplets from coughs and sneezes just sort of circulating around. So that may be the reason. If that is the reason, then with this thing, even with it being in Singapore and everywhere, it may well start dying out when it comes to, say, March, April, May, when people in this part of the world, even though it's very cold, we much more have our windows open, and for us to say, "Oh, what a lovely day." It's not freezing, it's not 5 degrees centigrade anymore, it's not 0 degrees, we haven't got frosts in the morning. Oh, it's lovely and warm. And so we have the windows open and go out of doors a lot more. So so that's the sense that's not the reason for delaying it. So I think the UK will act quickly, will be delaying it, and then that will be enough time to get more evidence to support the WHO stand. Because, as I just said, if we're delaying it to, say, middle of April, then Italy should have stopped its outbreak by then, pretty much contained it. It should be obvious. It should be like South Korea. It should be very obvious by then that South Korea have stopped their outbreak. They should have stopped it pretty much completely by then, unless they're having problems with people coming in from outside. So, if you look forward, what they've done in just, that's about 2 weeks, another another 2 to 3 weeks, then surely it'll be tapering off to just a few cases a day again. And then Italy, then Iran is the big unknown, but by the end of March that's probably pretty much contained as well. So I am very hopeful actually, as long as we don't have a big outbreak in a country with poor healthcare. And so the WHO have been sending out equipment and supplies to strengthen the African countries. And with their sub-Saharan Africa as particularly poor, low quality healthcare. And places like North Korea, then they're actually doing, they are pretty good at vaccines and things. And they are very good at, they're actually keeping people out of North Korea. So that's one thing they're good at. So even though they're surrounded or pretty much on all sides by infections, there are no infections left in North Korea. But if they do have any, then the WHO are ready to rush supplies and rush people out to them, and the sanctions won't get in the way of that. And they have a WHO office in North Korea, which they are in constant communication with. So don't worry about them. And they are, again, will try and contain it. If they do get a case, they'll contain it to just a few cases, just as is happening in all the other cases. A few cases, no reason particularly to have an outbreak in North Korea as either, so long as it's contained quickly. And same with Africa. So this is what they are. And for instance, Nigeria and the Ghana is already testing lots of people in order to try and find an outbreak in case there's something like Italy happens in Ghana, and they haven't found anyone. So this idea that there must be all these outbreaks happening, we know it's not happening in Ghana. At least they haven't found anyone yet. And I don't know, the WHO is recommending that all these countries, they tie into their existing fever clinics and their monitoring of severe acute pneumonia symptoms and so on, to kind of latch into the existing thing and test for COVID-19. So they're already doing that. Not necessarily everyone who does that, everyone is monitored in Singapore, and they're only finding the clusters. But in these other places, then they're monitoring selected people, and then some of them may eventually be able to do all of them. I'm not sure if they're doing all of them in Ghana, but if they are, but they're doing they're doing lots of them anyway. Anyway, whatever they're doing, then this is beginning to get a handle on whether there is any community transmission going on that hasn't been detected in any of these countries. So obviously, having seen the example of Italy, we want to try and find these outbreaks if they are occurring in other countries. And the WHO is strongly supporting that. So hopefully, either there are no outbreaks like that, and there's no reason to suppose there are any particularly, or if there are, then they're being stopped. And it might be, if the whole thing is right about that, in summer people being out of doors is the reason it's not spreading, then it might be that it's the time of year, because it's summer in sub-Saharan Africa, in most of sub-Saharan Africa, then maybe that is also helping to contain flu-like symptoms there of this disease. It's quite remarkable that there's not very much south of the equator. There's 1 or 2 cases in South America, but very little. And in Africa, even though there's quite a lot of communication back and forth. So I'm quite hopeful that we will contain it in these 3 places, that there may not be any other outbreaks, or there may only be just one that we'll discover that's like Italy, hopefully somewhere where it can still be contained, and with a government that is amenable to containing it. I think the chance that we have a big outbreak in the United Kingdom is very remote. A very small level of community transmission, a few cases, and then we just have these people in charge who have just been brought up with flu all their life, and they just don't believe the Chinese results. I think it's for those of us who are not expert in this area, and have not studied it all our lives, who are not professional, not even medical researchers at all, and then we go and listen to WHO, who are obviously expert, and then we say, oh, what they sound seems sensible. I think it's very hard for us to put to imagine ourselves in the shoes of someone who's been a professional all their life, like Professor Whitty, and they have a different perspective on it. But if the WHO are right, then Professor Whitty is wrong. There's just no two ways about it. So you've got to decide, do you go by Professor Whitty, or do you go by the WHO? And I go by the WHO. I think they've just been right all along. In fact, I've been very impressed by Dr. Tedros. Right from the beginning, he's obviously had a clear idea. It's almost like he could see the future. He has known right from the beginning that we have to contain this, long before there was sufficient evidence to really see it. And if it wasn't for his direction, then we mightn't have tried to contain it even. So I'm very impressed by Dr. Tedros and the Director General of the World Health Organization, and I will go for what Dr. Tedros says over what Professor Whitty says anytime. Dr. Tedros and Dr. Mike Ryan and Maria, her name is quite difficult to pronounce, these people are involved in stopping 200 epidemics every year. Whereas the people like Professor Whitty are involved in dealing with flu outbreaks in the United Kingdom. It's not the same thing. I think the World Health Organization are more expert in brand new, surprising, unusual, unexpected diseases. That's what they deal with all the time, with either ones that already, or strange tropical diseases with unusual characteristics and things like that. That is their bread and butter. And so I just think, so it's nothing to do with my views, it's because the WHO are saying this, and I'm very impressed by them, and I think they're right. And that's my assessment. And I don't think it's got to be one or the other. You either go with Professor Whitty or you go with the WHO. I go with the WHO. And for that reason, and all the evidence, and being also a mathematician, then I can look at all these graphs and curves, and I have a good understanding of the maths behind them, like, these ratios and things like that. I mean, it did look there. I mean, that is the Iran. You see, it does look as if it's tapering off a little bit, but this could be because they're constantly finding may still have a lot of new cases to find, and for the death rate, you expect that to be more like 7,000. Anyway, I can do all these number juggling, very easily, just because of my mathematical background. Indeed, for me, this is elementary maths. It's not at all advanced. It seems like school children maths in a way. The maths that I used to do was far more complicated than anything like this. And so anyway, so I can follow the maths, and then I can understand and then I greatly respect the World Health Organization, and that is why that I say this, what I'm saying. And so I expect the WHO to be correct, and not Dr. Whitty. And on this basis, WHO, they're still very concerned, but they think we are still very well able to contain it. And look, you can see the effect of China on this. And it's going to start going up a little bit, obviously, but then it can come down again. Like that. So I do think, and this is not like a religious faith, this is my best assessment, based on going to the reliable sources and deciding that, in my view, the World Health Organization, in my view, is more reliable and more likely to be accurate about epidemics than Dr. Whitty, Professor Whitty. So, given the choice, I go for the World Health Organization. And so, I think that in 6 weeks, it's very likely, if we manage to avoid another outbreak, that we do manage to contain this. And then if 6 weeks from now Italy has contained it, Iran has contained it, South Korea has contained it, Japan has contained it. Now Japan has a very strong motive to contain it because of the coming up with the Olympics. They can stop it before the Olympics. Wonderful. And so, if we get to the point where in the middle of April all those countries have contained it, and even if I can't see, and the cases coming into the UK, less cases per day in the UK because they're less coming from Italy and less coming from Iran, then I simply can't see the United Kingdom saying, okay, we're just going to stop containing it. Indeed, they would just see that their cases are reducing because nearly all of our cases are imported. And we're doing everything right according to WHO. So I am not worried about this. But I think that that there may be some embarrassment for the UK government for taking this stance when they look back at it, sort of like 3 months from now, when it's all over, and they look back and say, "Oh, we went the wrong way back then," and hopefully they kind of have the humility to see that. So anyway, I hope this helps some of you who's been worrying a bit about what's happening in the UK. We're definitely not. And just to say, Boris Johnson's taken on quite big powers on himself, on the government. Dr. Tedros said that maybe about them deliberately doing it. Where are they doing it? Gave itself powers to enforce self-isolation. So he has also said that sick pay will be paid right from the start. He has given himself powers to stop public gatherings and various other kind of quite large-scale things that he could do if he needs to. And Dr. Tedros has been saying all the way through that recently, in recent press conferences, that it has to be directed from the above. It's not the job of a health minister. It's a whole of government approach. So it has to involve the transport, the finance, hospitals, education, educating the public, and everything has to be involved, and the public has to be involved as well, know what we have to do. So the UK is doing that. So we are following the advice. We're just doing it to delay instead of containing. But really it amounts to the same thing. So I think we're going to be okay, myself. And so hopefully like a month or two from now, we can't say for sure. There is always the possibility that it gets much worse. WHO keeps saying to prepare us, prepare for the worst. Don't assume it's going to be okay. But work to contain it. Now, the very worst case, then it's not 80%, it's maybe 1%, 33% people get it, and then that would be far more than in China. In China, it would just be a fraction of a percent, and then of that percent, so only 1 in 1,000, 0.1%, 0.15%, I said, of the people in Hubei province get it. And then of those 0.15%, then a tiny fraction die, 0.7% of the 0.15% with the latest figures. So, and those are mainly elderly people, and we can protect them. And really, nobody needs to die of this. If you take the right precautions, then you can go all the way through Wuhan, as Bruce Aylward did. So here he is, talking to them without any protection. Because he said confidently to us, to the press and to the people looking over the internet, that he is not a contact. This chap has walked right up to the doors of FIFA clinics in Wuhan. He's gone through the market. He must have gone through the market in Wuhan. It'd be very important. He can't have missed that. He's gone to the hospitals. He's gone to the airports, the train stations and everything. He's talked to numerous people in Wuhan, always at a distance of about 2 meters, shouting at them. And then he came away again, absolutely confident that he is not a contact. He said, I am not a contact. I would not be here. I would not be wearing a mask if I was a contact. I simply would not be here. And so this shows that you can be totally safe if you know what you're doing. If you keep a distance like he did, if you, especially from people who are coughing and sneezing and snick, and if you, especially coughing, you don't get sneezing much with this. And if you wash your hands frequently, wash your hands before touching your face. You may have noticed that I'm not touching my face much. I'm trying to get out of the habit. It's really quite hard. There's a rather funny video where they're all I can't remember, it was shared in one of our groups recently, where all these officials are saying, when you have one way of fighting against COVID-19 is be sure not to touch your face, and then they touch their finger, they touch their, when you touch your tongue and then turn over a page. One of them did that, touch the tongue and turn over a page, or touch your nose or your eyes or whatever. So it's a good idea to get out of the habit of touching your face. I was quite impressed. Trump said, I haven't touched my face for a couple of weeks or something. I think he's actually more disciplined than he seems to be, than he sometimes seems to be, because I didn't see him touching his face. And they would certainly, if they had a picture of Trump touching his face, they would have that as one of the funny ones, and he didn't. So it is possible, like Trump, to learn not to touch your face. And I'm gradually learning. You may have noticed, I don't think I've touched my face during this talk. Go back to earlier ones, you'll find I did quite often. So this is a good thing to gradually learn in the public, because it'll make it much easier if in the future we don't have an outbreak. Now, if you have a case of coronavirus in your state, in your county, don't worry, you're okay. Unless someone has come around your door and said, look, you're a contact, please self-isolate, or phoned you up, then you're not a contact. And they would find the contacts pretty quickly. So if they've announced that a few hours ago they announced that this person has got it and is tested positive in your state, then you can be sure they talk to them and they go through all the people they've had close contacts with. They'll be ringing them up straight away. So if you haven't had a phone call yet, and you hear that someone has in your state has tested positive, then this does not increase the risk for you at all. Not at all. Only if you get community transmission in your state, and kind of large-scale community transmission, just one or two, is, they're immediately contained as well, and all their contacts. If you have large-scale community transmission, then you might start saying you're more of a risk, but then you can protect yourself completely just by doing these measures. Disinfect surfaces. Get out of the habit of touching your face. Wash your hands, and make sure you frequently wash your hands before meals, while making meals, before making a meal, while making the meal, at various times, and after making the meal. Wash your hands before eating. Wash your hands after you go to the toilet, which most people will be doing anyway. Wash your hand for 30 seconds, long enough to sing happy birthday. And just do a lot of washing your hands, and keeping your hands away from your face, and keeping a distance from other people. And you won't get this. And what's more, you won't get flu, and you won't get a cold. There was a nurse posted to our group saying that she never gets the flu vaccine, but she's never had the flu because she practices good hand hygiene. So these things work, even if you're around sick people all the time. So please don't be scared of this disease, because and if someone you know has got COVID-19, and still their risk is they're still got a pretty good chance, unless even if they're very old. They talk about how if you're old your risk is much higher. Right, it is much higher, but it's much higher than 0.2%, which is the risk for 30 years old, 40-year-olds, and 0% really for 9 and under. So your risk goes up to a few percent above 80, and some say 15%. I think it's less than that with the modern, better healthcare. And even if you're an old person with diabetes, with a heart condition, then you're still much more likely to survive than not survive, and your risk is similar to any other disease. It's similar to flu or something. So, so even if you got COVID-19 or you're caring for someone who's got COVID-19, then they still do have a pretty good chance. And of course, you'll be talking to your doctor at that point, anyway. But yes, just try. Be strong, be careful, and help and do it for yourself. Do the best you can. Dr. Tedros was saying, find out what's happening in your community, in your country. Keep in touch with public health advice, and play your part, and do whatever is required of you. And then together we can stop this. And if we can't, then we can certainly delay it for a good few weeks, and then it might stop by itself. And even if not, then we can protect the vulnerable and reduce its transmission, so it's only a fraction of a percent of the population that get it eventually. But we're not yet at that stage. Anyway, so I hope this helped. I hope some of you find this useful and enjoyable. So if you are, do join our Doomsday Debunk group on Facebook if you want to. If you are maybe a good fact checker, or you're good at helping people, and if you're good at helping people who are upset, and if you're scared yourself, then do come, and then the other members of the group will be helping you with your various concerns and fears and things you're worried about. And we don't do any sugarcoating. We do our best to find out what the actual facts are. So what I said today, I have not tried to swing this in any way. I may seem to be focusing on the positive, but I am somewhat saying the positive things because this is what is so missed in the media. But I'm not trying to swing this in any direction. I'm trying to tell you it just the way it is, absolutely straight. And that's what we do. Oh, and do subscribe if you want to join this channel. So I'll upload this now.